Hi, my name is Wong Wei Wei. I'm semester May 2020 student from oumh Ipoh. My ID is 9407110858300001. My course is oumh 1303 English for Oral Communication. Today my speech topic is about diabetic food care. Before that, I will give a brief introduction for diabetic mellitus. Based on American Diabetic Association 2003, diabetic mellitus is a group of metabolic disease characterized by elevated levels of glucose in the blood, resulting from default in insulin secretion, insulin action, or both. There is total 6 types of classification of diabetic. Number 1, type 1 diabetic. Number 2, type 2 diabetic. Number 3, gestational diabetic mellitus. 4th, diabetic associated with other conditions. 5th, impaired glucose tolerance. 6, pre-diabetics. What is type 1 diabetic mellitus? It is often occurs in childhood and adolescence, but it may occur at any age too. It is also characterized by hyperglycemia, which is a breakdown of body fat and protein, and the development of ketosis. Ketosis is an accumulation of ketone body produced during the oxidation of fatty acid. Is the result of destruction of beta cells of the islet of Langerhans in the pancreas. When beta cells are destroyed, insulin is no longer produced. It may be classified as either an autoimmune or idiopathic disorder. 90% are immune-mediated. Begin with insulinitis, a chronic disorder inflammation that occurs in response to the autoimmune destruction of islet cell. The process slowly destroys beta cell production of insulin, with the onset of hyperglycemia occurring when 80 to 90% of beta cell function of loss. It is believed both alpha cell and beta cell function are abnormal, with a lack of insulin and a relative excess of glucagon resulting in hyperglycemia. Now, what is type 2 diabetics? Type 2 diabetics is an condition of fasting of hyperglycemia that occur despite the availability of endogenous insulin. It can occur at any age, but it is usually seen in middle-aged and old people. There is sufficient insulin production to prevent the breakdown of fat with resultant ketosis. However, the amount of insulin available is not sufficient to lower down blood glucose level through the uptake of glucose by muscle and fat cells. Diabetic neuropathy. Diabetic neuropathy can occur in both type 1 and type 2 diabetes. Untreated high glucose level damage nerve. Peripheral neuropathy eventually spread to the ankles and legs. Patients do not feel pain because nerves have been damaged. Patients may be unaware of foot injury, which can lead to open sore. If this sore doesn't heal or they become infected, they result in more complications. In severe cases, toe or the foot need to be amputated. The importance of foot care. Diabetics can lead many complications such as peripheral vascular disease, which cause the reduction of blood flow to lower extremities. Diabetics also can cause neuropathy in peripheral limbs, which cause the pull in sensation on the foot, and diabetics patients may unaware the development of sore or blister on their feet. Due to reduction of blood supply to extremities, it causes the healing rate of sore or blister will be slower than the normal person. Besides this, diabetic patients might have higher tendency to get infection or amputation due to the slow healing process of the sore or blister. Check foot and toes, inspecting the top, inside, sole, heels, and the area in between the toes. If physically unable to inspect own feet, use a mirror or ask someone to help. Contact doctor immediately if discover any sore, redness, cut, blister, or bruises. Wash feet every day in warm water with mild soap. Check the water temperature with finger or elbow before putting feet in. Due to neuropathy, it may cause difficulty to sense water temperature with the feet. Pat feet to dry them and make sure to dry well. Infection tends to develop in moist area, especially between the toe area. If the skin on feet feel dry or rough, use lotion or oil, but do not use lotion between toes. Trim toenails after washing feet when nails are soft. Cut straight across rather than in a curved fashion to help prevent ingrown toenails. Don't cut into the corner. Use a emery board to smooth the edge. Be careful not to cut toenails too short. Choose comfortable, well-fitting shoes with plenty of room, especially in the toe box. Never buy tight shoes. Socks can provide an extra layer of soft protection between foot and shoes. Starting position, you sit upright on a chair without leaning to the backrest. First exercise, bend the toes of both feet with the heels remaining on the floors and stretch them again. Repeat this exercise for 10 times. Second exercise, lift the anterior part of the feet as far as possible with the heels remaining on the floor. Lift the heel with the toes remaining on the floor. Repeat this exercise for 10 times. Third exercise, the heels remain on the floor. Lift the anterior part of the feet, turn out and return to the middle. Repeat this exercise for 10 times. Fourth exercise, the toes remain on the floor. Lift the heels, turn out and return to the middles. Repeat this exercise for 10 times. Fifth exercise, lift the knee, stretch the legs, stretch the foot, toe pointing away from you, put down foot on the floor, and repeat with the other leg. Repeat 10 times per leg. Sixth exercise, stretch the leg with the heel on the floor, lift the extended leg, bend the foot, and remember, toes should pointing towards you. Return to the starting position. Repeat 10 times per leg. Seventh exercise, the same as the sixth exercise, but with both legs being lifted simultaneously. Repeat this exercise for 10 times. That's all my presentation. Hope you guys can learn something new from my speech. Thanks for hearing. Thank you.